Hello. Okay, that's working. Hello. Okay.
Okay, are you recording?
I am now. All right. Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rori Alter, head clinical coach here at Progressive Rehab and Strength. Excuse me, with my lovely co host, Dr. Alyssa IG, also clinical coach here at Progressive Rehab and Strength. And in this 10-minute tip, we are going to be talking about squatting with low back pain, what you can do about it. So, Alyssa, let's say
Let's start a timer.
Oh, that's a good call.
Let's say we start a timer.
Let's say we start a timer. Yeah. So if you don't know the 10-minute tip spiel, we start a timer. We
And
talk
then we
about,
ignore that.
and we ignore it usually because we never finish on time. So anyway, we set a timer for 10 minutes. We talk about a topic, give you some tips, and see you next time. So here we go. I'm starting a timer for 10 minutes. And we're going to talk about back pain in the squat and what you can do to continue training because we do not recommend stopping training altogether. We also don't recommend stopping the aggravating lift or some variation thereof altogether either. So, I guess the first thing that we kind of have to figure out is loads and where you're experiencing symptoms. We're not going to talk about load modulation because we've talked about it in a lot of other episodes. If you go back to the last 10-minute tip or pain and injury series, you can hear our philosophy on modulating the load in terms of injuries and the lift that you're doing. So first figure out if you can lift just lighter weight with a squat. But if not, then let's talk about where you're experiencing symptoms in the squat and what to do about it. So tell me about where people experience symptoms in the squat.
All right, Rory. So usually, assuming we've already
Gone through all
exhausted
that.
options, and you've listened to last week's episode about what to do with the weight if you can squat lighter weight and you're comfortable. But
hmm
if you're not and you are having symptoms usually most commonly at the bottom of the squat or at lockout or in that locked out position, and if those symptoms are happening even with the bar, we need to make some changes so that you can still do something and continue to move and squat comfortably. So if you're having symptoms in the bottom of the squat, the first course of action will be to shorten the range, and we like to use a box squat for that because it helps you know where you're going to and to go to that same spot consistently, especially if you're changing the depth from what you're used to and what your
hmm
normal is. Now you're relearning this other spot that you're going to stop at in the bottom. And we really want to keep that spot consistent. So you could set up a box right above the range where when you get into that range, you would start to have symptoms. When you do a box squat, you should squat totally normal and
hmm
just tap the box, and you're using it as a guide. We're not sitting on the box or losing tension, just gently tapping the box with your butt. I always say that if the box isn't there, you shouldn't fall over.
Right. Yeah. I mean,
um,
I think one of the misconceptions with box squats is that you sit down and you like sit down and that bar comes behind your midfoot like you're actually sitting in a chair, but that is not the way that we are talking about executing a box squat here at PRS. So you execute the squat the same way as if you were going down to the regular bottom position, but you lightly touch the box. You can slightly pause, but do not put your weight on the box and then stand up. Why? We don't really recommend pin squats when it comes to squats and back pain. Now, why don't we recommend that?
because oftentimes when people are performing pin squats, they kind of unload the weight of the bar onto the pins and lose tension in the bottom position and then regain tension and stand back up. And even if they're not doing that, most people aren't symmetrical. So it's
Mm-hmm.
pretty annoying to feel one side of the bar hit a pin and then the other one, and you just feel off.
Mm-hmm.
So we just don't find them to be like generally well executed or that beneficial in that
Yeah.
regard.
And I think the other like non lifting related thing is that if you're experiencing back pain, setting up pin squats is really annoying and can fatigue your back more. It can irritate your back a little bit more. Just we have to think about as coaches and as clinicians, we're not just looking at the execution of the lift. We're looking at the totality of the training session, and we want to think about how much fatigue is accumulating within the training session. So it's a lot easier to set up a box than it is to set up pins. Obviously, if there are no boxes and someone's stacking 45s, that's another consideration. So you do want to consider these things, especially with back pain. And going back to deadlifting, also we want to consider like how is someone loading the bar, and all that kind of stuff. So we just want to think of where is that fatigue or stress accumulating in the non-lift movement as well. In terms of having back pain throughout the range of motion, or with lockout, what would you recommend?
So the first thing that we want to consider before making changes is how are you unracking the bar? Is the rack set up at the proper height? Where is the bar placed on your back? Is it too low? Is it
Mm-hmm.
too high for your position and the way that you're squatting? So is it
Mm-hmm.
in a place where it is going to stay over your midfoot, or at least start and then start over your midfoot and stay as close to your midfoot as possible?
Mm-hmm.
Um, and uh, and, just generally, how are you standing at lockout? Are
Mm-hmm.
your hips
Mm-hmm.
flexed?
Right.
Or are you squeezing your glutes, keeping your knees locked, standing up straight? If all of those things have been assessed and we've exhausted options for improving them, then that's when we might move to, if you are a low bar squatter. Excuse
Yeah,
me.
right over there.
My voice is cracking. If you are a low bar squatter, then the first change would be moving to a high bar squat,
Mhm.
and then moving to a front squat, to just maintain a more upright torso angle and
You're right.
words.
Alyssa's having trouble today. She's all right.
And it can help maintain your spine in a straighter upright position,
Mhm.
which can reduce the stress on, and help reduce symptoms throughout the squat range.
Yeah, I think that's important. Sometimes we feel symptoms at lockout, but it's because of the position that our spine is moving into as we execute the movement. So even though you only feel the symptoms when you're locking out, even if we take it from a low bar to a high bar, or a high bar to a front squat, it just changes the back angle through the range of motion enough that it decreases that stress, so you don't get that accumulation of stress at lock or symptoms at lockout. And also, if you are a low bar squatter, then typically the high bar is going to be less load than the low bar, and the front squat will be even less load than the high bar. So you get this torso angle change and load change that can allow you to train at relative intensities that don't cause symptoms. We do like the safety bar squat in some scenarios, but for low back pain, I don't typically recommend the safety bar squat. And the reason I don't recommend it is because typically when that bar is loaded, we can get some upper back flexion, and that will bring the bar it will create a flexion moment or a stress of flexion on the spine, which can irritate the low back. And also, a lot of people get upper back symptoms from using the safety bar. If they, unrelated to low back pain, if they've been using the safety bar for like 4, 5, 6 weeks in a row and training at 8.5, 9, 10 RPE, they start to develop really bad upper back symptoms. So I'm not a super fan of that. I do like it. It has some efficacy in barbell training. We've got it, especially with shoulder injuries and stuff like that. But any of those specialty bars like safety, cambered bar, Duffalo bar, when it puts the load like further away from the center of motion and in like slightly forward but wider, that can lead to a lot of flexion and balance issues, and like decreased stability, which can irritate the low back. So I don't typically recommend those bars when we are rehabbing low back. We're going to run out of time. We've got a minute and 40 seconds. So let's say that we've tried all of these options. you Also, we can combine box squats with a change in bar position as well. So sometimes, and I talked about this lifter in our last 10-minute tip on the deadlift with low back, but sometimes we have to combine things. So this particular lifter, I started with a high bar box squat, and they were a low bar squatter, and also the sumo deadlift from blocks. So this person, we changed the range of motion and their technical execution as well. So we're moving into better ranges now, more of their typical range, but that's where we had to start in order to get them to be able to train during this time of inflammation. So you can combine things, box squat with high bar. I don't think I've ever done a front box squat, but I probably wouldn't take it that far. Have you ever done a front box squat?
I haven't had anybody that needed to
Yeah,
get
I've
that
never I've
far.
never been in that scenario. But typically if we get to that point, we're probably going to move to something more like a leg press, a hack squat, or power squat, like a plate loaded machine where we're not standing vertical with gravity. And that can allow you to continue to train your legs and your core without stressing your spine as much.
And even if you are able to do like a lighter box squat, but it's so light compared to the loads
Mhm.
that you were lifting, you
Mhm.
can still add in, as long as it's not aggravating, something
Mhm.
like a hack squat or a leg press
Oops,
to
we're
get
done.
more work in. Um,
Yeah, no, I totally agree.
just
Absolutely.
following that up after the lighter box
Yes.
squat.
Yeah, and I would always do the as main movement as possible first, or the most aggravating lift. So even if you're kind of combining, when we're talking about the program as a whole, if someone's dealing with back pain, I wouldn't do their bench and overhead press lifts first. I would do the aggravating lift first. And so that there's no fatigue accumulation when they're doing that, and then move into the other exercises for that training session. So, if you've got back pain when you're squatting, deadlifting, benching, or overhead pressing, you can certainly set up a free consultation call with us. The link is in the show notes. You can join our free Facebook group, The Secret Society of Barbell Mastery, where we do free form checks every Monday and nope, just kidding, Wednesdays and Fridays. And we periodically we do live Q&A recordings for the podcast. So if you have questions, or if you have issues with your training, your program, or you've got questions or topics you want us to cover, you can definitely join us in there. And you can also get on our newsletter to receive the podcast episodes early, get access to our free lectures. We do 2 free lectures, a literature review and a case study every month. So you can join us for that and get information on our mentorship program as well. So thank you, Alyssa, and thank you everybody for listening. And we will see you and talk to you next time. Bye for now.